So hello everyone, welcome to today's Ask the Expert session for pharmacy. My name's Kate, I'm a careers consultant at Newcastle University, and I'm joined by Laura and Rachel, who are both our MPharm graduates from Newcastle University as well, and they are going to be telling you a little bit about their experience studying pharmacy, and also since going into pre-registration and the pharmacist role themselves. So without any further ado, I'm going to hand over to Rachel for you to share your screen and take us through your presentation.
So my name is Rachel, like Kate said. I'm a Newcastle graduate. I graduated in 2021. Before my degree, I did the Partners programme, so that was in summer of 2017. After graduating, I then was a trainee pharmacist. I did this at Linemouth Pharmacy. And currently I'm just waiting for my exam results, and hopefully will become a pharmacist within the next few weeks. But that's just a whistle-top tour, so I'll just go into some detail. So Partners was in summer 2017. So yeah, I really enjoyed this experience. I recommend you really get stuck into it. Lots of opportunities to meet other students. I met lots of friends there that I'm still friends with to this day. And you can also meet lots of your lecturers that you'll be meeting in September, hopefully. And yeah, lots of great opportunities. I'd really recommend to go to all the social events, or as many as you can, meet lots of people and really see what university is like. So after a Partners programme, I got my results in the summer and joined the MPharm degree in 2017. So as you probably know, it's a 4 years master's degree. It's an integrated course, so you will learn about lots of different subjects, but this will all be integrated throughout the 4 years. There's lots of placement opportunities, so another top tip would be to really get stuck into those. There's some placements that are compulsory, but there's some that's also you can choose to do. So I'd really recommend doing those. It helps you to explore what you'd possibly want to do after your degree. But yeah, really good course, very integrated. All the lecturers are really friendly and really helpful, so definitely make the most of it. So during university, I had a part-time job. So this was at Linemouth Pharmacy. I also worked at a pharmacy in Amble too, but all part of the same company called Burdon Pharmacies. I'd really recommend the company. They're very supportive. They're always willing to give you lots of opportunities as well. So I've listed the pharmacies there. So if there is any that's near you or you think you could travel to, then please do let me know. They're always looking for students for work experience or for part-time jobs. So please just get in touch with me. My LinkedIn and my Twitter is at the end of the presentation. So just get in touch, and I can pass you on to whoever can sort a placement out for you. But really good company to work for, like I say, lots of opportunities, and they're really good at supporting you throughout your degree and throughout foundation training and beyond that. So yeah, definitely get in touch if you're interested. So I graduated from Newcastle University in 2021, so last year. Really lovely day. All your lecturers should be there, or most of them anyway. So yeah, definitely, it seems so far away, 4 years, but it will fly by so quickly. It definitely did for me anyway. So yeah, then I went on to do my foundation training year. So this was with Linemouth Pharmacy again. So I stayed with them throughout my degree, and then they took me on as a I say pre-reg, it used to be called pre-reg, now it's called foundation training, yeah. So yeah, this is a year sort of placement where you choose to do your training in. So I chose community pharmacy, but you can do hospital placement, you can do join between hospital or community and GP, whatever you want to do. So yeah, like I say, I would really take the opportunities throughout uni to do all the placements, because it really can help you choose where you want to do your training year at. So yeah, like I say, I did mine at Linemouth Pharmacy, which is a community pharmacy. lots of different pharmacy services that I got involved in, really useful. They sent me on some hospital placements, which I actually did with Laura, funny enough. So yeah, really make the most of them, and really make the most of any opportunities you have, really. I also became a mental health first aider. This was sort of in between my degree and my foundation year, but this was offered through the university. So if you do have the chance to do that, I would really recommend it. I've used it more times than I thought I would, quite sadly, really, but it is really useful to have. It's a really useful thing to have in your toolkit, especially when you're edging on to becoming a trainee pharmacist or a pharmacist. So yeah, and yeah, definitely make the most of that. So now I'm just waiting for my exam results. So after your training, yeah, you will do a big exam, and after that, if you pass, hopefully you can become a qualified pharmacist. So I know that your degree has differed a lot from when I did it. So I think now when you guys graduate, you will automatically be a prescriber. That wasn't the case for me or Laura. We'd have to do like a separate course for that. But yeah, hopefully you guys you will become prescribers at the end of it. So yeah, like I say, I'm currently just waiting for my results. I have got a job offer with the company I've been with from the start of my degree. So really looking forward to joining that job. So that's a full-time pharmacist in the community, but I really hope to maybe work in a GP practice, and you know, I really enjoyed also hospital pharmacy. So you never know. I think there's a lot of paths with pharmacy. You can do lots of different things. So like I say, have a think about that throughout your degree. Have a think what sort of sectors you want to go into. But yeah, definitely want to become a prescriber in the future. So I think that's on my future goal list, really. Yeah, like I say, feel free to contact me. There's my LinkedIn and my Twitter. Contact me about with any questions you have. And also, like I say, if you do want some work experience, do contact me, and I can see what I can do. But yes, good luck to you all. I hope Partners Programme goes okay, and I hope that you get into the course that you want to do, obviously pharmacy. And yeah, good luck with all of that. Thank you.
Perfect. Thank you, Rachel. It was really insightful. We're going to take questions for Rachel after we jump to Laura's presentation.
Okay, so my name is Laura. I work at Northumbria, hence the very colourful Northumbria PowerPoint. So I studied at Newcastle, kind of. So I was the first or the last cohort who started their degree at Durham. So I did 1 year at Durham and I spent 3 years in Newcastle, and I graduated in 2020. And I'm now a hospital pharmacist at Northumbria. So I've got my Twitter and my LinkedIn at the bottom of every slide. So if you guys want to follow me, feel free, or connect with me on LinkedIn. That's absolutely grand. So I guess this all started with my A-levels. I did not know what I wanted to study. I applied for 5 different courses at 5 different universities, because I truly did not know what sort of path I wanted to take. Everything centered around pharmacy. I just didn't actually apply for pharmacy. So when I got my A-level results, I went through clearing because I didn't make my firm choice. And pharmacy at Durham at the time was in clearing. So I thought, well, why not? It sounds like a nice way to spend 4 years. You get to learn about the human body, you get to learn about drugs. It just sounded like a really, really good way to spend 4 years, to be honest. So that's what I did. Spent 4 years at uni from 2016 to 2020. And then I did my pre-reg year. And I did that as a split. So I split GP and hospital, just because I really wanted that kind of GP experience in my back pocket, just if I did decide that I wanted to go into GP later on in life. It's not for me at the moment. I like being on a ward. I like having lots of doctors and nurses and healthcares and physios and everybody around me. But I think in the future, particularly when I've got my prescribing, GP would be something that I'd consider again. So now I'm a pharmacist. I qualified, when did I qualify? Last summer, because my exam was delayed a little bit. So that's where we are now. So I've got a little bit of a slide here about the MPharm. And I kind of just really wanted to show here some of the stuff that I did on top of my MPharm. So everybody goes to uni, or not everybody goes to uni, but everybody on your MPharm is also at uni. But here are some of the other things that you can do, and that you can find time to do. Your MPharm, it is intense and there is a lot of learning, but it's not constant. Like Rachel said, she had a part-time job. I did some of these things. So I played for a hockey club all the way through uni. I peer mentored and I was a parent. I did the Young at Heart clinic in 4th year, which was where we volunteered in Granger Market and we took people's blood pressure. And then based on the result, either they were fine or most of the time we referred them to the GP practices. We didn't ever have, or I personally didn't have any blood pressure emergencies. I did an optional placement on top of my compulsory placements in the RVI in my 4th year. I did an internship in 3rd year, and off the back of that, we then presented a poster at the Learning and Teaching Conference in 2019. So that was a really great opportunity. And I got to work with a couple of my student colleagues, I'm not sure what the right word is, and some really great lecturers to make that piece of work happen. Again, in my 3rd year, I was the welfare officer for PharmSoc, and then in my 4th year, I kind of stepped it up a notch and applied for president, and did some really cool things in hindsight that are still running on now. So kind of introduced the idea of having a summer ball. So now every year we have 2 balls. We have a winter ball, a summer ball. We started inviting the lecturers, so it's a really nice. I saw some of the photos from the summer ball that's just happened. It looked incredible. So it's a really good vibe. There's netball teams, football teams, academic support, there's socials, there's the parenting. We had a bake sale, charity things in my year, and academic lectures as well. So there's a lot going on, and there's a lot more that you can kind of make of your degree than just going to the lectures and the seminars. So this is a slide that I used last year, and to be honest, I was looking at it and it all still rings true. So this is kind of the stuff that I was doing as a pre-reg, but this is also what it is to be a pharmacist. So you're constantly asking questions and answering questions. You're taking drug histories, doing meds rec, which is where we compare a drug history to what's prescribed and see if there's any changes, if those changes are intentional, whether we can optimize the medications. Clinically check everything, so every single medication that the doctors prescribe for our patients is our responsibility. We need to be having a look at that. Taking telephone queries, we're doing research, audits, QI projects. We're communicating really effectively with everybody else on the wards or in dispensary. If you do choose to become a pharmacist, you will communicate with so many different people, regardless of which sector you go into. I'm sure Rachel communicates with people all day, every day in community pharmacy. The same is true of hospital. And I'll talk about some other careers that you could think about after doing a pharmacy degree in a moment. Our entire job is problem solving. It's great being able to spot a problem, but I think the thing that makes you a good pharmacist is spotting the problem, understanding the problem, and then coming up with a solution or solutions to the problem. So if one of my doctors has prescribed something that I'm not sure about or doesn't look quite right, so we've kind of identified the problem, then we need to look at why do we think it's a problem and what can we do to kind of solve that problem or make the outcome better for the patient. And obviously that requires a lot of teamwork between all sorts of different people. If you come into hospital, you'll be working in a team with other professions that you didn't even know existed, probably, because I certainly have. We also do supply. Supply is a lot of our job, and we ensure safety and apply the law. You'll get a lot of doctors, especially if you come into hospital, not necessarily knowing the law around particularly controlled drugs. So your morphine, oxycodone, codeine, midazolam, things like that. So this is my current job. Here's a couple of pictures of me wearing my lovely scrubs. So this is my uniform in hospital, green scrubs. It makes me very identifiable. I work at Northumbria, which is comprised of a lot of different hospitals and a lot of different areas. So I work between Wansbeck, which is WGH, North Tyneside, NSEC, which is the big emergency care hospital, Hexham, all the way over in the middle of the country. There's also Cumbria, Northumberland, Tyne and Wear, which is the mental health trust up in the northeast, and primary care. So a lot of our pharmacists also work in primary care, which is GP practice. So ward work, responsible pharmacist, dispensary, all of these things and everything that I've just talked about really make up your job. You don't ever have 2 days that are the same. And that is really, really, really true if you work in hospital. So over on the right-hand side, there's a picture of me there with one of the lovely nurses. And if you're a little bit eagle-eyed, you can see in the background, we're actually in a school gymnasium. So the reason this photo was taken is because we went to the school and we vaccinated over 700 kids in one day. So myself and another pharmacist, we were in charge of kind of production of the vaccine because it comes in these teeny tiny little vials, which are really highly regulated. You have to move it very slowly. It has to be within certain temperatures. You can't drop it, you can't shake it. And we have to make those up with saline, and you have to be trained to do that. So we were making the vaccines, training people, and essentially overseeing the vaccination of more than 700 kids in one day. We also had to use our kind of first aid skills. There were a couple of not quite fainters, but a couple of kids who weren't looking too great and things like that. So this job really does take you all over the place. There's a bunch of other career options that you could get into if you wanted from an MPharm. And this is kind of why I liked the idea of studying pharmacy. I had no intention of becoming a pharmacist. That kind of happened by accident and I fell in love with it. But it gives you so many options. And MPharm isn't just for Christmas, but you really do, you learn so many different skills. So you can go into mental health pharmacy, you can work in GP practice, community pharmacy, you can work in prison pharmacy, you can get involved with clinical trials, research. Big companies like GSK, they always hire pharmacists because we have experience of pharmaceutics, which is basically making tablets, formulations, seeing how they flow, how they work, which pretty much no other course has experience of. So we're really valuable in research as well. You can go on to do a PhD in all sorts of things, which you'll get experience of in your 4th year when you do your research. There's lecturing you could do, auditing. There are specific roles for pharmacists who audit GP practices. You can go into production, so aseptics, making chemotherapy. Specialties, there's all sorts, absolutely all sorts. If there's a part of the body, it's probably got a specialty that's attached to pharmacy. You can go into teaching, there's grad schemes, so you're not just limited to pharmacy. Once you've got a pharmacy degree, you have a degree, so you can go and do any kind of grad scheme really, within reason obviously. But some of the ones that I know that you can apply for, just had a little look. You can apply for the NHS grad scheme, some of those courses. There's a civil service grad scheme. There's a police grad scheme. Really, there is all sorts out there. There's also medical writing. You could go into big pharma if you wanted to become kind of a drug rep. Armed forces, they always need pharmacists, and I think armed forces sometimes fund bits of degrees, but you would have to double check that. And you can become a portfolio pharmacist, which basically means doing little bits of all of that stuff, and just have a portfolio of experience. So that's the end of my slideshow. But if you guys have any questions, I would be more than happy to answer them.
We have many, many questions that have been pouring through as you've both been talking. We have about 45 that have come through, so I'm not going to guarantee we'll be able to get through them all, but we'll try and get through as many as we possibly can today. A couple of them are along the same line, so I'm going to group them together and theme them. So I think one of the big sort of questions that are coming through at the moment is your work-life balance. So how you sort of finding balancing sort of your work both in hospital and community pharmacy with, you know, doing other things in the world in your life as well. So Rachel, have a go at that one first for me.
Yeah, so I think during my degree, I think depending on what stage of the year you're in, so I think at the beginning it's a little bit easier to get a few extra shifts in. Towards the end, obviously towards your exams, it's probably going to be a little bit harder. But you know, whatever pharmacy, if you're working in a pharmacy, they'll probably be understanding of that. It was a bit difficult to get used to at the beginning of working full time as a trainee pharmacist. It did take maybe a few months to get used to it, but it definitely, you know, you can find that balance, and you do have time to do other things, and that goes throughout your degree as well. So yeah, I mean, it like I say, it's difficult to get used to, but I think, you know, once you get that balance and once you start to manage, you know, if you know, any time outside of university for any revision or anything you have to do, I think you can get into it, and you can do other things as well. It's not just work. So yeah, it's just finding the balance.
I'd agree with Rachel there. So I think during my MPharm, the work-life balance was great. It wasn't ever really something that I worried about too much. During your pre-reg, I think you do need to become slightly more aware of how you're feeling and taking account of your kind of just taking stock of yourself. Like, have I had some time for myself this week? Have I done something I enjoy this week? Am I going to bed early enough? Which are things that I hadn't really thought about before. But as a pre-reg, you work full time and you pretty much also study full time, because you're doing assignments, you're writing evidence, you're studying for an exam. Now, the format of that, by the time you guys are pre-reggers or foundation pharmacists, that might change. That might look a little bit different, given some of the reform that's going on with the MPharm at the moment. As a pharmacist, I think it gets easier again. You're not studying all the time. I'm doing my diploma at the moment, which is a postgraduate qualification in clinical pharmacy. So that is offered in most hospitals up north. In fact, I would say all of them. I don't know anybody who's not been offered this. It's a little bit different sometimes in community and GP practice, so it would be worth asking about. But I have an exam tomorrow, and I'm not worried about it. I hung out at the weekend. I saw my pals. Yeah, it becomes a lot easier. And I think just make sure, even through uni, just take stock of how you're feeling. If you've been out every night that week and you're absolutely shattered, go to bed. You're not going to remember that one night out, but you probably will remember feeling awful the next day.
Thank you very much. Very, very sage, very good advice. I think, you know, one of the really nice questions that we've got through here is what does it take to form, you know, good patient-carer relationships? Rachel, we'll come back to you first.
Yeah, I mean, this might differ between me and Laura, because I know in community you have sort of the same patients, you know, a lot of the time, and you get familiar with the regular patients that come in, people that get monthly repeat medication. I think it's just sort of, even if they can get a little bit argumentative with you maybe, or, you know, just, you know, disagree with something, I think it's just trying to keep a smile on your face and just trying to keep them happy, really. Try to sort of change your language or change the way you speak to someone based on sort of who they are potentially. So you know, just be aware that some people can be hard of hearing, or something like that. There's a lady that comes in very frequently who had a stroke, so it's just trying to figure out how to communicate best with certain types of people, really. But yeah, like I say, just sort of get to know your patients in community anyway. It's a bit harder in hospital, as Laura, I'm sure, probably knows and probably explained, but yeah, just get to know them as much as you possibly can and build that relationship with them.
Yes. And Laura, I'll hop over to you with the added bit there of, we've had a question that's come through as well, that what Rachel's saying is that communication sort of changing and altering that style. So, as well as that, building that sort of relationship, how you do that, do you think that through that you develop any sort of different work persona?
Yeah, a little bit. So I think in community, I think Rachel's right, you do get to see the same patients and you get to build rapport over quite a long time with them. Whereas in hospital, you have to build that rapport very quickly. You have to walk into a room with someone that you've never met before and get them to trust you and feel comfortable with you very, very quickly, to be able to do your job in the most effective way. So I think if any of you ever come into hospital as a healthcare professional, whether that's on a placement or as a pharmacist or whatever else you guys decide to go and do with your lives, just remember that most people in there are very, very scared, and they might be acting out towards you, but it's not at you, it's because they're scared. So I've had a couple of patients who have been quite aggressive towards me, but that's all part of the job, it's okay. But actually, when I've spoken to them and kind of knuckled down, what they're worried about, the outcome has been very, very different. There was one guy who was really, really upset with me being in the room, but I kind of led the conversation to what he's worried about, and if anybody had ever taken the time to talk to him about his medications, and sure enough, he was actually really taken aback. He was like, no. And he was just feeling really frustrated and really scared because he didn't understand what was happening with his medicines. He didn't understand what changes were being made. And the end of the conversation, I was like, all right, hopefully everything goes okay. I'm around all day on the ward. I'll probably be here longer than you will. Let me know. I can come back if you think of anything else. And he was like, all right, thank you so much. I'm going away to the Lake District and it's absolutely lovely. You should definitely go. It's absolutely lovely. And a lot of these people are just looking for someone to kind of reassure them. And sometimes hospitals are really, really busy places. So it can be quite difficult to take a step back and realize, well, okay, this patient's not angry at me. This patient's scared and they're in an unusual place and they don't know anyone. So it's kind of just reframing that problem. But I think you probably do, to an extent, learn kind of a customer-facing personality almost. Whatever is happening in your life, you switch and you walk into a patient's room and you're like, hi, my name's Laura, I'm one of the pharmacists. I'm just here to have a chat about XYZ. Is everything okay? Are you in any pain? Are you comfortable? You just switch into that. Even if you're having an awful day, you go and see your patient and you make them try and feel as comfortable as possible. But it is good. Sometimes it makes you feel better as well.
It's always a sort of a smile, and then that sort of, as soon as you're smiling at someone else, it can kind of brighten you as well. With that sort of in mind, we've got quite a good few questions coming through about sort of how you actually manage dealing with stress. So if there is anything you would sort of change or dislike about your role as well, what sort of the challenges are. So anything you want to comment on along that theme, Rachel?
Yeah, I think there is times it can get quite stressful, especially during busy periods, and especially during COVID, that also changed a little bit. But yeah, I think one of the main things is obviously that the NHS are trying to switch people to see their pharmacist before maybe their doctor, especially for minor things. And I think a lot of people can't really accept that that a pharmacist can help with these sort of things. I think people think that, you're not a doctor, so, maybe I should go see my doctor about this instead of you. And I think it's just trying to, sort of deal with that and sort of try and keep cool and, yeah, it's just really sort of taking a deep breath really, and sort of keeping cool, keeping calm, and collected, and not letting them see that you're maybe getting a little bit stressed about something. Yeah, I don't really have much to do with stress. I think, like I say, just sort of reflect on a situation. If it was a bit stressful, reflect and think, how could I maybe have done something differently? So potentially, if that situation was to arise again, that you wouldn't feel as stressed. But yeah.
You've made some great points there, and you've actually addressed one of the other questions that were in the chat about if you've ever felt disregarded by a patient. Answered that perfectly. Laura, anything for you on stress, or anything indeed you would change or you find challenging about your job?
I think everybody has a moan about their job sometimes, but I think at the end of the day there isn't actually anything I would change about my actual job. I think it can be stressful. And especially when you're newly qualified, your stress tolerance, you build that up very, very quickly. But I think the thing that I probably do when I'm stressed is, so for example, I made a mistake the other day at work, and I think as pharmacists, we're quite bad at admitting that we've made a mistake, because we're the ones that's supposed to check everybody else's mistakes. And there's sometimes this quite perfectionist kind of thing about being a pharmacist. But I went through into another room and I was like, guys, I've just made a mistake. And they were kind of like, oh, like, what did you do? So I told them, and I talked through it with them, and they were like, oh, okay, like, I also didn't know that. There was no harm to the patient. So, that was the first thing that I was worried about. Had any harm come of this? No, the patient was fine. Did we fix the mistake? Yes, we fixed the mistake. And actually, another couple of pharmacists also did not know that this would have been an error. So the next thing I did was go to the guy who deals with all the errors. So I datixed myself, which is kind of an error reporting system, just so that other people could learn from my mistake, because I'm sure it's not the first time, and hopefully it will be the last. But it might not be. And we talked about it, and we talked about how I was feeling about it. And that, I think that gives you a really good space to kind of, if you are stressed about it, which I was a little bit stressed, it gives you a space to kind of talk through how you're feeling and talk about what we're going to do to kind of make that not happen again, and also maybe how you would deal with it better. So I think, and this is probably something that I didn't do very well at uni. I don't think I reached out when I was stressed at all, and I should have done, but I think sometimes that's hard to do. But nobody, especially within pharmacy, all of your lecturers, if you guys do come onto pharmacy, they've all been pharmacists. They've all done this job. They all understand that sometimes you get really stressed, and you will, as a student, it will happen. Something, it might be small, but you will be stressed about it. But just go and talk to them, because they understand how you're feeling. I think that's what I would say about stress, for sure.
Perfect. And I think, we've raised some really, really important points, and we've had questions about, how you develop in that reflection, that, sharing experiences, the even, the more practical qualifications and diplomas that you're all doing, but that constant self-reflection is how you develop as a student, but in your career as well. And I think, just to reassure people in the chat that, if you are stressed at university, there are plenty of, support services that are there to help you. You'll have, a wellbeing, dedicated wellbeing advisor now that's part of your sort of your pharmacy school that you can reach out to. You can chat to the career service. There's plenty of that support. But I think, Laura, what you mentioned there was really important. You went and talked to your colleagues, and we had a question through about how actually important is teamwork and the role you have within as a pharmacist, and how you sort of develop those good working relationships. So Laura, you're on that topic, so I'll come back to you, and then we'll jump over to Rachel to answer that as well.
It's interesting that that's come up, actually. So I had a scenario a couple of weeks ago where I was on a ward. It was a gastro ward, and some of the patients on gastro wards can be quite challenging. So we have a lot of patients who use IV drugs. We have a lot of patients who use a lot of alcohol, amongst other things. a lot of substances, and it was always a challenging ward in terms of TTOs, which is the discharge prescriptions. They would always come down quite late and everybody would be stressed about it. The doctors would be trying to rush this thing, nurses would be trying to rush the patient, you know, getting ready, and we'd be trying to rush the medications. Very stressful for everyone involved, and it didn't need to be. So I spoke to the ward manager, and we had a chat about it, and we kind of identified where the problem was. And I then asked her if she would kind of coordinate with the occupational therapists and the doctors and the nurses, because she was a ward manager. She's kind of got the power to do that. So we did that. The ward med assistant came along. I was in dispensary, so unfortunately I was not there. But essentially what happened was we all kind of talked around the discharge process and the problems that pharmacy face within that. And the discharges on that ward are so much smoother now. There's no stress. Pharmacy's not stressed. The doctors aren't stressed. Then like everybody is just so much happier, and it's made such a positive change to that ward. And like at the time when I was talking to this ward manager, did it go as well as I wanted it to? No. Was it a bit stressful? Yes, it was. But the positive outcome that has kind of resulted from that little bit of teamwork, working with everyone, has just been incredible. Like it's really sorted the ward out, and everyone is so much happier for it. So I would just say, wherever you go, just introduce yourself to everyone. Just walk up and, you know, be like, hi, my name's Laura. I'm one of the pharmacy students here today. And they will probably teach you something because they love their job. And you will find out so much random stuff, and it will just make you a better person. So yeah, teamwork is super key, especially in hospital.
So obviously Laura's got a big sort of MD team, multidisciplinary team to sort of be in. How about you, Rachel? What about your sort of teamwork in that community setting?
Yeah, so I don't work along as many sort of healthcare professionals as Laura do, but all the pharmacy professionals, so you have all the pharmacy technicians, the dispensers, also the counter assistants, and obviously other pharmacists potentially. So yeah, it's just really, you know, building that rapport with them, getting to know them getting to know you, and I think when you build that relationship, they're more willing to help you, give you advice, support you throughout your degree, your foundation year. So yeah, it's just really building a relationship with them, getting to know them, and also you can learn a lot from them as well. And yeah, everyone's human, everyone's making mistakes, but I think because when you have that team to discuss things with, like Laura said, I think it makes it a lot easier. And also not just within the sort of, if you do go into community, not just within the place you work in, but also building that relationship with, say, the GP surgery nearby that you're going to have to ring up a lot with different queries or questions or problems. So it's also just building relationships with these other sort of people that you might potentially be ringing or emailing. But yeah, it's really important to make these relationships, like I say, and it'll make things a lot easier for yourself. So yeah.
Since we are on the topic of that community environment, we've had a question in as well for you, Rachel, about, you know, what effect has COVID-19 had on the sort of the community pharmacy environment for you?
Yeah, so I think my project at university was actually about the impacts of COVID on community pharmacy, and I think through that, and also just through working it, I think I found that a lot of patients have now realised how much pharmacy can do, which has potentially made community pharmacies a lot busier. So they seem to be reaching out a lot more to pharmacies for minor problems, or even sometimes major problems that really they probably should be going to hospital for. But anyway, but yeah, so I think it's made people realise the amount of services they do, and maybe because it was one of the most accessible places during COVID, they've come in and they've seen all the posters for all these services that we do, like B12 injections, like vaccines, travel vaccines, smoking cessation, stuff like that, weight management clinics, and they see all these posters for this because they're coming in more frequently, and they seem to be using them more. So it has made it a lot busier, which sometimes makes it a bit stressful, but it also makes you feel a bit more worthwhile and more seen as a community pharmacist. So yeah, it's been nice, but obviously it has had its downsides, the fact where it is busier, and especially when it was isolation and COVID and having to keep your distance and stuff and limiting the amount of people in the shop, and that got a bit difficult. But now that's all seemed to have calmed down, hopefully. It's a little bit easier to communicate with people. So yeah.
Fabulous. And that's a bit about that community environment, but Laura, sort of in the hospital environment, we've had a really good question coming in about what you do like about your role as a hospital pharmacist compared to other roles in healthcare in the hospital.
So I think my job, I basically get to stare at lists of drugs all day, and I get to, which doesn't sound that exciting on the face of it, but when you think you get to go and see a patient, you've got a bunch of patients, and you are thinking about them as a whole person. So you're thinking about their past medical history, you're looking at their bloods, you're looking at all of their OBS, so their blood pressure, heart rate, respiratory rate. You are looking at their BMs, stool charts. You get to see the whole patient, and then you're looking at their medication and you're thinking, how can I optimize this medication for this specific patient? And you could have two patients who are almost the same, but maybe one really doesn't want to be on any medication and they want everything stripped back, and that would make them feel happiest. And maybe the other patient wants everything, and it's just, I really like it, and I really love getting to work with the doctors. So I work really, really closely with all of the doctors on the wards that I work on. And the longer you spend on a ward, the more the doctors get to know what your role is, and the more you kind of know what each individual doctor's role is. So you really do learn a lot from each other. And I think that's also something that's really cool. So because they're there all the time, if I'm looking at something and I don't understand why they've made a decision, I can go and ask them. And if they don't know, they ask the consultant, and the consultant can come and explain to me. So I get to learn stuff all the time, all day, every day. I get to learn stuff. I get to think about each individual patient's medication, which is what we are specialists in, and optimizing that for the patient. And then if you come up with a suggestion that somebody else is like, oh, had you thought about this instead? And you hadn't thought about it, you're then learning something completely new. And you're learning of a new kind of way to process that information and deal with that patient. And equally in hospital, you then get to do your prescribing. So you can prescribe, then you can do your advanced clinical practitioner. So you can go and independently review patients in a similar way to the doctors do, but obviously with a pharmacist kind of spin on it. It's a great job. I love it.
Good, perfect. And you've touched on it a little bit there, but we've had a question come through saying, when you're in a hospital, which of your colleagues or which role do you find you're interacting with the most? Is it the doctors or is it something else?
Definitely the doctors. I think if I'm on the wards, it's 100% the doctors. If I'm in dispensary, so you do a dispensary slot maybe twice a week if you're at certain sites. I would say then it's the ATOs, so the dispensers, because if you make yourself quite a friendly, approachable presence, they will come to you with questions, which is great because then they're learning too. And it won't necessarily be questions about what they're dispensing. It might be, what's this for, or why have they ordered this and this, or this warning's coming up, what does that mean? They'll ask you all sorts of questions. But I think generally day to day, it's the doctors that I spend most of my time interacting with. It's a lot of time. You'll get to, and I know everybody hears horrible things about doctors in what do they call it? Interprofessional education. Sometimes the medics, sometimes there's these rumours that go around and everything. All of the doctors I have worked with have been absolutely lovely. Really thorough, really thoughtful, really appreciative of a pharmacist's job. I think it's just different at uni, but when you qualify and you work with doctors, they're really, really appreciative of you. It's really nice.
I'm going to ask you to comment on one more thing, and then I'm going to ask Rachel the exact same question. But sort of, Laura, the balance, you mentioned a lot of different things you do. You dispensing shifts, you're staring at your drug charts, you work with your patients. What would you say sort of on an average week is your balance between that sort of patient contact time and that other responsibility that you have as a pharmacist as well?
It really, really depends. So it really depends what site you're at as well. So if you're at NSEC, the turnover is really high, and you tend to spend a lot of time with patients. You're taking drug histories, you're sorting discharges out. If you've got time, if somebody's got, some, or counselling, we always do counselling, but sometimes if you have got time, you might just have a chat with a patient that's been in there a little while because, they're a little bit lonely. Obviously, whilst you're, counselling them about the medication or something, but then when you're at base site, that can vary because at base site you tend to cover at least 2 wards and do dispensary slots. So it's probably a little bit less at base site, just because you do have so many other responsibilities that you don't get to chat to your patients as often. It really varies, and it varies week on week as well. If we have a lot of discharges and a lot of patients that have medication changes, we'll probably counsel those a lot more than if we have no discharges. But we have a lot of other stuff going on that we need to review. It's really hard to say. Rachel probably has a lot more patient contact than I do on a daily basis, so I'll let her tell you guys about that.
So yeah, we'll hand over to Rachel. What about your sort of patient contact, and tell us a little bit about your other responsibilities, as a community pharmacist, as well as interacting with those patients.
Yeah, of course. So I get a lot of patient contact. I think as a pre-reg, maybe a little bit more than when I'm qualified potentially, because I'm not qualified to check prescriptions yet. So I sort of work alongside the pharmacist, and if there's any patients that come in with any queries or anything, I'm the one that's sort of pushed out there to deal with that. And obviously you will do that as a pharmacist as well. So yeah, a lot of patient contact. I'd say about 3/4 of the day is sometimes spent out in the front of the pharmacy or in a consultation room, dealing with patients. For example, if they have a new medicine and they have some questions about it, or if you're handing that out and telling them some information before they start taking it. We also do a new medicine service. So when a patient gets a new medicine, we'll counsel them, so tell them a little bit about the medicine and some side effects and stuff to look out for before they take it away. But then we'd also give them a ring after a week or two taking it, and then maybe after a month of taking it, just to make sure they're getting on all right with it and they're having no side effects and that's working okay for them. So I also help out with that service. I help out with all, the flu vaccinations during flu season. You can do some vaccination training and take part in that. But yeah, a lot of patient contact and community. But like I say, when you do qualify and you can check prescriptions, a lot of your time is also spent doing that. So either checking just normal prescriptions, or we do dosette boxes and we check those. So it's making sure that it's clinically correct for the patient, which can be sometimes hard in community because you don't have sort of a wide picture of what's going on with the patient. You can literally just see their medications. So I think that's what also, when I did my hospital placement, that's what I found that differed a lot between community and hospital. With hospital, when you're reviewing medications, you can see sort of the full picture, whereas with community you have to do a lot of sort of thinking, okay, so what could potentially this medication, interact with if they have a certain condition. So sort of like putting a little sticker on the bag and just saying, make sure to mention this when the patient collects the medication. So a lot of communication with patients. But yeah, it's just something that you sort of get used to dealing with a lot. But yeah.
So we're coming to sort of the end of the time that we've got today. So for you both, we've talked a lot about the role of a pharmacist in sort of the hospital and community. But what would be your sort of one top tip of advice for these students in your audience who are, currently just about to embark on their pharmacy studies? What's your main top tip for them? Laura, I will come to you.
So obviously, as you guys saw earlier, I got involved with a lot of stuff during my M Pharm. And that would probably be my top tip, whether that's a job on the side or getting involved in sports teams or research or societies. I would really just recommend doing something. Don't just stare at your books all day, because at the end of the day, once you've got an MPharm, whether that's the first, second, third, nobody asks about your MPharm because you have to go and do the pre-reg exam anyway, which kind of standardizes everything. So although your grades are important and don't slack on them too much, I would recommend doing something outside of your studies. Talk to people, talk to lots of different people, because that's what you're going to be doing for the rest of your career. And those communication skills are really, really valuable, and I really can't emphasize that enough. Just talk to people, have a chat with people, have a chat with little old Doris down the shop. Chat with as many people as you can.
Perfect. And Rachel, your top tip?
Yeah, I think mine's very similar to Laura's. I think, MPharm degree can be a very sort of stressful, especially at the beginning, a very new experience. But I think definitely try to find that work balance and try to have as much of a social life as you can. I really miss university for that. So definitely, make the most of it. The Pharmacy Society do a lot of socials, so make sure you go to that and you can meet different students throughout the different years. But yeah, just get involved in any opportunity you can, really. Push yourself out your comfort zone, and yeah, just get involved with anything you can. It always comes in handy. So yeah, that would be my top tip.
Fabulous. Well, taking a big thank you to both of you for giving up an hour of your time today, for joining us for these sessions, for all your amazing, wonderful insight. And thank you for the students who are sort of sitting here in the background and asked such sort of fabulous, really insightful questions that hopefully you've had a good time answering as well. And thank you all for sort of joining us today. Hope you've enjoyed it.
Thanks everyone for joining. I hope we did answer some of your questions. And like Kate said, feel free to reach out on LinkedIn or Twitter if you do think of any more questions or you want to know anything else.
Yeah, same as Laura, please reach out. I'm always contactable on LinkedIn or Twitter. So yeah, please get in touch and good luck to everyone.